I'm explaining internal medicine. So, internal medicine deals with the clinical diagnosis and medical care of adults across the entire spectrum of health, ranging from the office to the intensive care unit. I practice a non-surgical specialty that specializes in the diagnostic workup, medical treatment, and coordination of care. Internal medicine deals with knowing a little about a lot and utilizing my diagnostic acumen in order to determine what a patient's problem is. And if I can't treat the patient medically, I need to know who to get on board to fix it. No patient gets scoped, cut open, or irradiated unless I'm able to complete my investigation and refer the patient to a gastroenterologist, surgeon, radiation oncologist, etc. In the United States, internal medicine is a 3-year residency that follows 4 years of undergraduate, 4 years of med school, and can be optionally followed up with 1 to 3 years of fellowship in the various subspecialties dedicated to adult medical care. These include cardiology, allergy, endocrinology, sports medicine, sleep medicine, and whatnot. Internists who elect to practice general internal medicine straight out of residency will usually work in a clinic as a primary care physician or in the hospital as a hospitalist. I'm the latter, but also I'm special, and I'm doing an administration fellowship and halfway done with my MBA and gunning for a C-suite position as a physician executive. And as a hospitalist, I practice acute care medicine as part of a hospital system on the general medical wards. I take care of sick patients who are too ill to be seen in the office, but not sick enough to deserve intensive care in an ICU, trauma unit, or burn unit. When I admit a patient under my name, I become their primary physician for that hospitalization, and it's my job to figure out why they landed in the hospital and how I can get them better. My name goes on the top of their chart, and I accept full medical legal responsibility for everything that happens to them under my roof. I handle everything from admission to discharge, and a significant amount of time is also spent on discharge planning and follow-up, where working with my case managers also helps me get a deeper insight into the American healthcare system and how I can help my patient the best. I like the responsibility of being the quarterback for my patients and directly making the decisions that lead to them getting better. I also prefer working in a hospital setting because I know I'll have quick turnaround time on labs and imaging, nurses caring for my patients 24/7, and subspecialty support on call.